The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Hello, I'm Carl Seidel, host of The People's View. The show is sponsored by the Nashua City Republican Committee, and if you like to attend our meetings, they're the second Thursday of every month at 6:30 at the Crown Plaza. And if you want to find out more about our organization, you can go to nashuagop.org to see our website and learn about the events that we have.
Welcome to The People's View.
Hello, and help me welcome Lynn Blankenbeker.
Hi, Carl. Nice
How
to
you
see
doing?
you. Great, thanks.
You've been in the Navy? No, not the Air.
Navy and Air Force,
Navy
yeah.
and Air Force,
Yes.
both of them.
Yes.
So now you're on reserve, and you're going to keep on running here in New Hampshire.
Absolutely, absolutely.
You were here before when you were representative from Concord.
Yes, yes.
And now you're going for the Congress, huh?
Yes.
That's
yes.
the whole half of the state. You're covering a lot of area.
It is a lot of geography, from Canada all the way down the western side of the state and across the southern border right there on Massachusetts.
Well,
yeah.
welcome to Nashua.
Oh, thank you so much.
Hope the people here keep a warm welcome for you.
Well, thank you. So far, it's been great.
What are you going to do when you get elected?
Well, you know, Carl, it's, after I spent 5 years at the Pentagon, so I'll back up a little bit because of my legislative background, because of my legal background, I'm also an attorney, because of my long healthcare background, and because of my military experience. I was asked to go to the Pentagon and do healthcare policy, and that was in 2012. Same time you were coming out of the House, and that's why I didn't run for re-election in 2012. And I ended up at the Pentagon for what was supposed to be a 2-year tour for 5.5 years. Between the Pentagon and the Defense Health Headquarters, trying to figure out how we were going to do healthcare policy at that very high level. And so, but it was there that I got that front row seat to the dysfunction that was going on in Congress.
It's terrible.
Fighting and the resistance movements and
Yeah.
the polarization, and that caused such gridlock, and we weren't able to get anything done. And the Pentagon has 23,000 people, 60% of which are civilians, not military. So every time the government shut down, or we had a continuing resolution, or a furlough, or sequestration, 60% of the workforce couldn't come to work. Now, you can only imagine how hard that is if 60% of your employees couldn't come to work for today and getting work done. So it really does have big implications, when they can't get along and they don't sit down and do the work that the people of the United States expect of them.
Well, that's an immense area. I mean, that's how many hospitals are involved and all that?
Oh, with the military?
Yeah,
well, I was doing healthcare for the military and for the Veterans Administration, and so we have over 600 medical treatment facilities within the military system. You have Army, Navy, Air Force, Marine Corps, although the Marine Corps shares with the Navy, and then the public service. And then those facilities could be dental clinics or medical clinics. They could be full-blown hospitals. They're across the globe. It's the largest healthcare system in the United States. And then, of course, we have all the VA hospitals, at least one in every state. And, VA clinics and VA facilities, lots of those.
Well, you have a competitor that's involved in that now, but did you learn enough that you could help get it to run smoothly? Because that's really an insult to all our veterans.
It is, absolutely. After you care for like a person like me, I spent all those years in the military as a combat nurse, and my time over in Afghanistan from 2011 to 2012, and you take care of these warriors right out of the battlefield, and it's your hope that when they come back home that they're going to get the same level of good quality care that you gave them over there. And it's disheartening to come home and find out that they can't access care. I just saw where the poor veteran was struggling to get in to get some VA care, and he couldn't, and he ended up committing suicide waiting because he couldn't get in. And that's just a tragedy.
Yeah.
And so, yes, to answer your question, I did get a lot of experience. You know, I've had 23 years of healthcare experience as a nurse, both delivering and receiving care in the single payer system, the military, and in the private sector, like you and I get, in our private health care, because I'm a reservist. So I get to do both. I'm a civilian Monday through Friday, and then on the weekends, I'm a reservist. But also, I have done healthcare policy at the highest level, where I've interfaced with Congress and congressional mandates on how we're going to govern healthcare. And I'm also a healthcare attorney. So I've dealt with all the laws, and then I was a legislator. So I sat on Health and Human Services when I was here at the State House. So I've been at the lawmaking or policy-making level as well. So I think I come with a pretty diverse background to be able to.
That has a lot to cover.
Yes.
I mean, you know how to write it, you know how to implement it. Yeah.
Certainly know how to give it and receive it.
Somebody ought to give you a whip or something to keep them in shape so they follow the instructions. Wow. What other things are you looking to help on if you get elected?
Well, Carl, I think it's so important. We can't even get to the issues when we can't solve the problems, right? We've got to come together and get folks working together. And I think together we would then be able to tackle solving the problems. The opioid crisis is we got to. It's multifaceted. We've got immigration problems. We've got problems with the way the way opioids are delivered and out there on the street. If we're trying to deal with healthcare, for example, we need tort reform. There's so many different facets to all these problems. But the biggest problem we have is that nobody's sitting down and working together to solve the problems. And so that's what I would intend to bring. Being in the military for all these years, I've worked with people in Army uniforms, Air Force uniforms, Navy uniforms, Marine Corps uniforms, Coast Guard uniforms. We come from male and female, every color of skin, every national origin, political background, religious background. But we all took an oath to protect and defend the Constitution and to protect our United States because we're Americans first. And that's the ethos I want to bring to Congress. If if 1 million people in a uniform can do that, certainly 435 people in Congress can do that. And Carl, it's the same oath. When you go to Congress and you take your oath, you take an oath to protect and defend the Constitution, just like we do in the military. So look, the way I look at it, same oath, just a different mission.
It's gotten a little bit rough that way. I mean, I just noticed it in the 10 years I've been up here that we argue a lot about things that instead of trying to find a way where we both can be satisfied with the result, we just stubbornly hold out for
Absolutely. And I think a lot of that just comes with walking in lockstep. I think folks sometimes don't vote for or against the issue. They vote for or against the person who's presenting it.
You're right, to a certain extent. I know we had a little special session just last week that there was a lot of personalities that decided something. And here we had the Senate 100% voting one way and the representatives, Democrats and Republicans, splitting in such a funny way that you couldn't, you wouldn't believe it. You said, what the heck happened,
Yeah.
And this is something that is going to affect a lot of people, and I don't think anybody wants the end result, but they can't agree on how to stop it.
Right. Well, and it's so important today, especially for national security. Government shutdowns, I think those have become bad habits. Continuing resolutions within our Congress, those have become bad habits. We haven't had a balanced budget since 2006. That's a travesty. And that's Congress's job, is to provide a balanced budget for us, a responsible budget that they can stick to. We haven't had that. Instead, they've resorted to continuing resolutions, which, oh, by the way, there's no congressional or constitutional provision for a continuing resolution. So they've resorted to that. And I think that they've resorted to that as just because it's become a bad habit. And I think there's some people that need to go home. They've been there 30 and 40 years.
How do you feel about term limits?
I am absolutely 100% for term limits. I think that you come in, you get in, you become effective, you do what you need to do, and you need to get out.
Do you have an idea how many terms they get?
I would be an advocate for a congressional term being 4 years rather than 2 years.
Okay.
And the only reason I would say that is because no sooner do you get in and you get your feet wet, you're campaigning again, because we do it here in the
Sure,
House of Representatives in New Hampshire. And so you're focused, you're distracted. You're distracted by fundraising, and you're distracted by campaigning and earning votes. And so I would propose maybe a 4-year term and maybe 2 term limits, like our president, maybe. Something a little more reasonable like that.
Okay.
Did you know that there's a bill before the House right now that the Congressional House that you after your 3rd term you can only earn $1?
Oh, really?
If that passes,
I didn't
that'll
hear
be
that.
very-
I heard that's one way to limit terms.
It'll be self-limiting.
Yeah.
Or at least you'll know who is really dedicated.
Well, I put that in the, if you don't balance the budget, then you don't get paid.
There you go. Yeah,
Then
right.
you go home.
Yeah.
I mean,
Yeah.
something like that. But it is something, I don't know how you're going to work in getting all these people together. You have an idea of how, you've been down there, you know what the politicians are like down there.
Well, first of all, I think, there's 400 of us that are military that are now campaigning this year across the nation.
I knew there was a lot. I didn't know it was that
A lot
many.
of military folks have decided to take off the uniform and step into this
Maybe that's the
area
way to
of
do
public
it.
service. So I think if we can clean house, get some of that, we're all coming with the same ethos. Carl, when I was in boot camp in the Air Force, when I was a very young lieutenant, there was a sergeant who said to us, look to your right and look to your left. You may not like those people, but you better learn how to respect them, because one day somebody could save you. And all military people are trained like that. We all, have to get along and work towards a common goal. So I'm thinking if 400 new people do get elected, well, then we're all coming in with the same ethos. The good news for me, I've been endorsed by War Veterans Fund, and there's 4 of us that they've selected. One's an Air Force KC-135 pilot, a female. One's a Green Beret, Army. One's a Navy SEAL, and then me. And so we've already come together. We met in Miami, we met in Dallas, and we met in McLean, Virginia. And so we've built a coalition already, so I feel like I'm already going in with reinforcements. And we're all coming with the same ethos. We're there, mission-oriented, ready to get the job done.
Well, do you think the present administration is good for this or not so good for this type of approach?
Oh, I think it's good. I think our president has demonstrated that he's willing to sit down and negotiate and talk. I mean, look what he did with North Korea and South Korea. Look at, look at Russia.
I think people don't appreciate
Yeah.
that.
No, I think, what do they tell you in kindergarten? Don't fight, use your words, right? We're supposed to be using our words to work things out. And so instead of being angry and using, inflammatory words, that doesn't get you anywhere. We need to start solving the problems. We need to get together and start working. I think our president has been a phenomenal role model for that. Now, I don't know if I'd necessarily choose some of the words he chooses, but it works for him. It wouldn't work for me.
No. Well, he grew up in New York. I grew up in New York, so I can appreciate that.
So you can, yes.
So that's a little bit of a area problem, I think. But he is, I don't know if you've heard it, he's invited the legislators down to the White House.
Yes, I heard that. I was trying to get in on that. I was trying to get a little tour myself.
Oh, yeah? Okay.
Are you going?
Yeah.
Oh, so you guys leave like tomorrow or the?
No, it's next week.
Next week,
Yeah,
okay.
it's the 8th.
Oh, very good.
So, I don't know what to expect, really.
Well, if there's an empty seat on the bus next to you, I'd love to go for a ride. I would expect that, just given my time in D.C., I would expect that it's going to be very welcoming. It's very different than under the Obama administration. Very, very different.
Very different. And different than even the Bush administration.
Oh, absolutely. Yeah.
I don't know if you knew, my daughter actually was a Deputy Assistant Attorney General under Bush.
Oh, I did not know that.
Yeah, she's an attorney too.
Oh, excellent. Very good.
She's going to accompany me down there.
Oh, very good. Darn.
So.
I thought there was going to be an empty seat.
I got a companion.
Oh, good for you. Good.
But anyway, she was kind of interested in that because it was kind of testy in that when she served too.
Sure.
It was very, very argumentative. And that babies I probably started even before Bush. That there was a lot of problems down there. It wasn't working as a team like it should. But you
Yeah.
know how to work like a team.
Well, we do. Those of us in the military, you got to make sure that you take care. We all have battle buddies, shipmates, wingmen, whatever you want to call them.
Right.
But and it's good to have those reinforcements. But I think at the end of the day, you got to stay focused on the mission.
Right.
And that's where I think we've lost sight. Our mission is to take care of America. We're all Americans.
Well, what other problems do you see is the ones that are highlighting the activity down in Washington?
Well, I think if we all watch the news, you'll see that immigration's been a hot
Yeah,
topic.
right.
And certainly I support securing our borders. I do think it's important that we know who is inside our borders and who's in our country. And, probably just like your family, my family came to this country. I'm second generation. My parents were first generation born in this country of immigrants who came over legally. Both my parents served in World War II. Very proud Americans. That my father was a Marine at the Kwajalein Atoll. My mother was an Army nurse. And so we assimilated as Americans, came over legally. And, so there is some value. There's definitely value to bringing folks from other countries over that bring their good ideas and bring all that wealth of, the diversity. I like to think of us as a big salad bowl, and,
Well, yeah.
here in the United States. And that's what makes the United States so wonderful. But when your borders are porous, you get crime and opioids and bad actors that come across your borders. And we need to...
Yeah. I can't see how people want open borders when you have it's not everybody, but you got to look at everybody to be able to weed out the ones you don't want.
Well, absolutely. It's no different than your own home, right? You lock your door because you don't want bad people in, and you invite in who you want in your home, and you're discriminating at your border. It just happens to be at your threshold.
Right.
And so there's no difference as far as locking down our borders.
Yeah. Well, what do you think about this idea of getting rid of ICE that's they're promoting?
I'm sorry, getting rid of ICE? Oh, absolutely not. They have
they're
a lot
doing that
they're
job.
doing a good job. I think that those enforcement officers that are down there are important. I think that the only way we're going to secure our borders, there are places that are just designed to build a wall.
Oh, yeah.
And there's other places that won't support a wall, and we need to look at some electronic means or whatever. And then we've got those agents down there and our National Guard doing exactly what they're trained to do.
That's right.
That's why we have them. And so I think it's important. I think the agency is important for making sure that we have a check and a balance for who comes in and who doesn't, and enforcing the laws that we have on immigration.
That's, again, you've got to enforce all our laws. Why do we have laws if we don't enforce them?
Exactly. And if they're bad laws, we need to look at changing those or repealing them. But if they're, if the law, if I think it's incumbent upon us to enforce our laws. When you don't, it's like the empty threat that the mom makes. If you don't stop that, we're going to leave the grocery store, and you never leave, right? And the kid still misbehaves.
Right. And what do you think? You've been involved in the bureaucracy. I use that word without trying to disparage all the people, because there's a lot of good people in there. But they get stuck in a routine that they don't see, they don't always notice where it could improve, to meet the objective of doing a effective, efficient way of whatever the process is that you're involved in.
Right.
And you got to do an evaluation of how every once in a while to see whether you need to tweak it or get rid of it.
Exactly. And I think you hit the nail right on the head. People talk about bureaucrats, but I really think it's the bureaucracy, it's the process. And so we get into this layer upon layer upon layer of bureaucratic process, and generally what happens is because it's a lack of accountability. So, if you took something very simple, Medicare, Medicaid, or you talk about, folks in the hospital, and there's this lack of accountability in the hospital, and so medical accident happens, well then we better put a scorecard on our website to show the world that we're really doing a good job. So now all of a sudden, all those doctors and nurses that should be at the bedside caring for the patient are now sitting at the computer cramming in data. Right? So that we can prove to the world that we're doing a good job. And what happens to the patient?
Yeah.
Medical accident after medical accident, and it doesn't get better, it gets worse
Right.
because this bureaucracy and this red tape, and and then CMS says, well, if you don't fill out your scorecard, we're not going to give you reimbursement. Then the doctors say, well, if you're not going to reimburse me, it just goes, it never
It goes
ends.
downhill.
And so I think that's what happens. You hit the nail right on the head. It just becomes one layer
Right.
after another layer, and when there's too many hoops to jump through, then you get an accident. Or you don't ever get to the intended result.
That's right, yeah. And you ought to solve it by getting input from the people who are doing the job.
Exactly. Well, and that's exactly why I've been doing the ride-alongs and going out and trying to learn about the opioid crisis in the state at the at the deck plate, or right at the root, right? And so I've gone on ride-alongs with the police department. I've gone to the safe stations. I've met with providers who are dealing with the problem of chemical addiction and those sorts of things. And what I've discovered are things that are very shocking and surprising that I would bet if you asked folks in Congress if they knew if that was going on, they wouldn't even know. And it's because you're exactly right. Nobody's down at the deck plate working on it. We're trying to, the military is divided into echelons.
Yeah.
And echelon 1 would be the Pentagon, and echelon 2 would be another command. And echelon 5 are the warfighters out on the, out on the battleground, right? And so when you've got somebody up here at echelon 1 that's got to get through 2, 3, 4, and finally down to 5 to effectuate the results, somehow in all of that layer, the process, you get muddied and
well, at least in the
cloudy.
military, you have to go upwards through the layers.
Yeah.
The politicians don't necessarily have to do that.
Well,
they
no.
take big jumps and they have no experience.
Exactly. And look at how many people, I would venture to say that there were maybe a handful of folks in Congress who had enough medical expertise to develop a healthcare plan for this nation. And yet we got a 1,200-page healthcare law in this nation. How many doctors and nurses and providers and how many of that? Not many.
They got enough reading to do.
No, I think we had, I can't remember the exact number back then, but about 27 healthcare providers, people who had healthcare experience,
some experience
out of 435 people in Congress.
Yeah. I'm glad that those are fewer that are in there because they can give a perspective that's needed.
Yeah.
But I've seen some things here too. The people in the different departments don't have the basic background that they need.
Sure.
They think they know organization, but they haven't worked their way up through a business organization.
Right.
They've worked maybe through charities or nonprofit organizations a lot.
Yeah.
And sometimes I worry about that. Just seeing, they don't see how they can do the job better. Or they didn't search to see, get input from other people.
Yeah.
Maybe that helps.
It does. It does. I think it does. And I think we've seen that, over and over and over again with certain congressmen or women that are, certainly serving now and you scratch your head and say, wow.
Well,
How'd that happen?
in a way, and maybe you saw it just in the short time you serviced in the state here, we have a good audit system here. And I don't know if you've read the audit reports, but Health and Human Services one used to get audited every year.
Yeah.
But they never always respond to the audit. Now, why not at least cover it and decide why you're not going to respond to it?
Right. Well, and I think there needs to be some accountability.
That's right.
There absolutely needs to be accountability, and we've got to hold folks' feet to the fire.
So we have a little problem here, but not as big as the one you're looking at.
Well, but it's my hope, I think it takes strong leaders and strong leadership
that's right.
to get there. I feel like I'm probably a proven leader. I was selected, as you know, when we were in the House together as the Vice Chair of State and Federal Relations and Veterans Affairs as a freshman legislator, and I think that folks recognized that with my background and my leadership experience, at least the state felt that way. And then now I'm the commanding officer of a medical unit out in San Diego. So I have 877 sailors under my command.
Wow.
So the Navy felt like I had enough leadership skill to take care of those 877 sailors. So, hopefully when I get to Congress, folks will recognize that I do have some leadership acumen, and that I'll be able to bring some credibility, some integrity, and those leadership skills to Congress. I'm used to taking heat under fire.
That must have been nice duty in San Diego. I like that place.
Oh, I'll tell you, getting out there is hard though, because
Yeah.
I have to fly out every month.
Yeah,
So
oh, yeah.
getting there is a little
Oh,
hard.
boy.
But
Well, how's your campaign running? How's your
It's-
team coming?
you know, it's going great. I have a wonderful group of volunteers. I have a
Uh-huh.
wonderful staff. Folks are very committed to the campaign and excited and energized by the campaign. We're running a really strong grassroots campaign. We're out there every day, knocking on doors. As a matter of fact, my change of clothes is in the car. As soon as I'm done here, we're going to get out and meet some of the nice folks in Nashua this afternoon.
Okay, good.
And that's just how we roll. Remember,
Yeah.
I won that special election in 2009 in Concord,
Yeah.
and I did it knocking on doors, and I did it again in 2010. And we're going to use that same
2010 was a good year.
it was. And we're doing that again. And so I have teams, it's funny because folks have said to me, Lynn, when there's a big event, a barbecue or something like that, I don't see a lot of your people. I'm like, nope, you won't, because my folks are out knocking on doors and meeting people all through the district. It's a big district.
It is.
Canada to Massachusetts.
Right.
We got a lot of geography to cover.
Yeah.
So we're out there knocking on doors. I think our message is great. Great opportunities like this. Thank you very much to talk and let folks hear about our campaign. We certainly, so I think we're doing a really good job.
Okay.
Fundraising's, we can never fundraise enough. I'll always take money.
Unfortunately, yeah.
But we have a very strong, robust fundraising.
So your contact is your website or a phone number? Or
Yes, my contact is either Blankenbeker.com, BLANKENBEKER, or what's easier is Lynn, LYNNE, the number 4, NH. Folks can jump right on there. There's all kinds of ways to sign up to help. They can hand out literature or stand at the polls, put a yard sign out. They can, all those things you can sign up there. And there's a big yellow donate button right in the middle, so they can push that too.
Well, I put one of your signs out where I live. I saw
thanks.
that.
Yeah.
I don't know who did that, but
Yeah, well, folks are getting them out. I think folks are excited. They're ready for change. And I think they know that I'm the person that can bring that change for them.
Okay.
Yeah.
Well, I think time is up.
Oh, my goodness.
So good luck.
Thank you so
We'll
much.
see you. And
It's always a pleasure, Carl.
It's going to
great
be
see
a
you.
heck of a primary, isn't it?
It is. Well, I'm more excited about the general.
Wow.
I am excited. I've got some questions to ask, and I really want to know why Ann Custer holds her hand up against funding our military while people like me sit over in Afghanistan and hold the hands of wounded warriors.
Yeah.
I have some questions, so I'm ready to,
Good,
have a
good.
conversation with her.
Well, I hope everything works out well for all of you, and that one of the things that I don't want to see is that not everybody's going to get through the primary. We got to put the team together again.
Absolutely, absolutely. Well, thank you, Carl.
Thank
It's a
you
pleasure.
very much.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.